today's topic is especially meaningful: purpose and connection, how to get involved with the Alzheimer's Association. We'll explore how the Alzheimer's Association supports families, caregivers, and the community, and the many ways you can get involved, from events like the Walk to End Alzheimer's to resources that bring real connection and support. We're delighted to welcome our guest speaker and expert panelist today, Heather Beck, director of the Walk to End Alzheimer's DC Walk with the Alzheimer's Association. Heather is a nonprofit fundraising and development strategist who has dedicated her career to advancing the mission of living in a world without Alzheimer's and all other dementia. Please join me in giving a warm welcome to Heather.
At Visiting Angels, we're committed to enriching the lives of elders and their significant others. Our monthly coffee chat sessions aim to make your lives easier and better by providing quality information from our expert panelists. We're here to elevate your quality of life, offer practical wisdom, and ensure you have access to valuable insights.
Thank you. Thank you so much. I'm so privileged to be here with you guys. I love working with Visiting Angels, and you guys do such great work within the community, and we are excited about our partnership together. The Alzheimer's Association, as you may know, has a mission to lead the way. Oops, has a mission to lead the way to end Alzheimer's and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. Our goal is a vision, is a world without Alzheimer and all dementia. This number here, we're going to get into a little bit more information about some of the key resources that we have. So one of the key resources, and Michelle can attest to this, is our on phone help, our 24-hour, 7-day-a-week helpline, which provides assistance to anyone that has Alzheimer's, they're caring for somebody that has Alzheimer's, that has questions. It's 2 o'clock in the morning and you don't know what to do and you need somebody to talk to. Feel free to reach out to our helpline. We have 200 languages. We have 24-hour clinical experts that can help you. And again, this is a 1-800 number, free for you. Also online is our website. Our website provides a lot of information that helps for caregivers, helps for professionals, helps for volunteers. A lot of information that we provide to our constituents. And in our communities nationwide, we also have a website available for you and provide you with support. So you might ask, what are ways to get in to join the fight and to get involved? And we have a variety of different ways that you can get involved. You can volunteer. We have many volunteer opportunities at the office, at our walks, at our events. And there's just really a plethora of ways to volunteer within the organization. Advocacy, trial match, and the Walk to End Alzheimer's are just some key ways. There are many ways that you can get involved, but these are just some of the key ways that you can get involved. So whether you'd like to spend a few hours a week or you'd like to make a commitment by being maybe on a committee or helping out the day of the event. Again, there are numerous ways to get involved, but you can go onto this website and this shows you all the different ways that you can be involved. One of the different things that Michelle works with and that we have within the community are community educators. And so this is another great way if you enjoy public speaking and would like to learn a little bit more about how to get more involved with speaking within the community. That's another great way of getting involved with Alzheimer's and spending your time. Um, another way is our walk committees. And we couldn't put on all of these events without support from individuals like yourself. And we couldn't put the day of event on without individuals. So if you're interested in helping out, I'm going to tell you a little bit more about the day of the event for the DC walk. But we have 6 different walks within the community. Our largest walk is the DC walk, and the day of event volunteers can range from registration, cheering on people, handing out flowers in the Promise Garden. So there's a lot of different ways of getting involved. Set up, clean up, you name it, we need you. Advocacy. So advocacy is another way of becoming involved. All you need to do is to go right here onto this website. We just had a huge advocacy event where we went, marched on the Hill, and we do this every year. But there are a lot of different ways throughout the year that you can get involved through advocacy. Our trial match. So the trial match is it really helps us to advance Alzheimer research. It's a clinical match program. For more information on our clinical studies, just really go on to alz.org/trial match, and you'll find out more information about how you can get involved and what you could possibly qualify for. I'm going to stop there and see, Dexter, if we have any questions so far. So we have 600 walks nationwide, and one of the largest walks in this community is our DC walk. We have 6 walks, as I mentioned earlier, within the community. We have a walk in Prince George's, Southern Maryland, Manassas, Reston, Winchester, and DC. And we'd love to have you participate in the DC walk or any of our walks that we have nationwide. Here is the address for the Walk to End Alzheimer's. The DC walk, as I mentioned, is going to be on Saturday, September 27th. Registration starts at 8 a.m. We have a ceremony that starts at 9:30, and then the walk begins at 10 o'clock. It is on the National Mall, and you can register by going, register or donate by going over to the walk page. If you'd like to join and be a part, you can use this QR code right now, and you can make a donation to the Visiting Angels, or you can register and be a part of their team. The Visiting Angels of Silver Spring, Gaithersburg, Edgewater, and DC. And Will, our famous Will here, is our fabulous Will, I should say, is our fearless team leader. So he is going to be running the charge and would love to have you on his team. So this is a great way to participate. We have about 2,500 people that participate at the DC Walk, and we have over 300 teams that participate. Anybody can participate. It's free. Um, if you register and you raise $100, you get a t-shirt. If you register, raise $350, you start to earn some of the Alzheimer's swag. And then if you raise $500, you're considered a champion. And so, as being a champion, you get a special gift, you get recognition the day of the event, and you get to be a part of our Champions Club the day of the event. Um, when you register and donate $100 or you raise $100, you can ask people to donate for you. You don't have to donate personally. You can ask people to, and we're going to go over how to do some fun fundraising tips. But you'll earn your t-shirt and it is sent to you automatically. So you don't have to worry about picking it up. It is mailed directly to your home. Some easy fundraising tips. So make a $25 self donation to kick off your fundraising efforts. And really, this shows your personal commitment. And ask three friends to contribute $25. Once you've done that, then you've earned your $100. Maybe ask a family member to donate $100 and ask them to symbolize a 100% commitment to the cause. Ask businesses that you frequent, whether it's a hair salon, a nail salon, your dry cleaner, your favorite restaurant. Ask them to contribute $50. I personally have thought about this because we use different services on a regular basis and continue to go to certain restaurants, to certain personal care facilities, and asking them, because you kind of become friends with them, asking them to donate. And this is a great way to get a donation. Sharing your story and fundraising page on social media. So you can use when we have a link on, we have a lot of different fundraising tools when you register. When you register, you'll get a whole page of fundraising tips and tricks. And if you're a team captain, you'll get a team captain guide, as well as you're able to use our fundraising app. When you use the fundraising app, you'll be able to then link your social media, and the story then is yours. Whatever your story is, you're able to share on your Facebook fundraising link. And this is a great way to let people know that you're involved with the cause, letting people know your personal connection, and asking people, if they want to get involved as well. Holding a team fundraiser like a car wash, a bake sale, or restaurant proceeds night. This is a great way to, again, ask the local community to be a part of your fundraising, getting a percentage of those proceeds. And I know this is something that you've done, Will. Maybe if you can share a little bit about some of the best practices and some of the things that you guys have done, because you actually are one of our top teams at the walk. And I'd love to hear a little bit about from someone that's an actual team captain.
Yeah, thank you so much for the intro. Yeah, in terms of best practices, it's all about planning. So, um, we've been successful with raising funds. This is something that's near and dear to everyone at Visiting Angels because Alzheimer's touches the majority of our clients, families, friends, and loved ones. So about around March, um, every year, what we do is we plan out our entire year for fundraisers. Um, the tool we use to stay organized is Microsoft Teams to keep all of our files and our calendars together. And then when when an event happens in a month, what we do is a month out, we send a flyer. Then we send a follow-up email, and then 1 week before each event, we hit the streets. So our marketing team, myself included, we knock on doors and physically get the word out to boost visibility. In terms of some successes that we've had so far this year, we've had one thing we did different. We have T-shirt sponsors, so it's a great way for local businesses to get exposure, and it led to significant fundraising capabilities on our side. We had an international bake sale, which helped one build team camaraderie. Also, just the culinary skills of our team were were great, and that was very successful. And we've worked with some restaurants locally because a portion of all of our of everyone that comes through those doors, portion of those proceeds go to the Alzheimer's Association. And then I wanted to put a plug out that if anyone's in the Potomac area tomorrow, we're working with Brookdale, Potomac, and Heather's going to be there as well. And we are having crab cakes, and would love to have you support that event as well. But it boils down to having goals, clear goals, planning, and really kind of being creative as well.
Well, what's some of your as far as like sharing your story, how have you or have you shared the story of visiting angels when you talk with folks? Can you share a little bit about how that's influenced people to get involved?
Yeah, with visiting angels, one thing is many of our staff members, they have family members that have unfortunately been impacted by this disease. So it's near and dear to a lot of actually our staff. And when we are speaking to individuals, we have them specifically um, talk to different groups to kind of share their story, um, because visiting angels and with what we do, it's all about you have to kind of lead with the heart, um, and provide that additional support, and providing those personal stories has really been something that moves a lot of families, a lot of clients, and a lot of people that are trying to give donations.
So it's a horrible disease, and we definitely need a cure. And put me out of a job, put Michelle and I out of a job. We want to
Mm-hmm.
find a cure. I mean,
Mm-hmm.
we don't want to be faced with this in the future. I'm going to open it up to Dexter and see if we have some questions.
Later. Anyway, yes, Heather, what can Alex do to reduce anxiety?
I would just share, we are not physicians, but I would recommend the 24-hour, 7 days a week helpline. We do have clinicians on that helpline. You could be more specific about the anxiety, like you're sharing here, that is mostly in the mornings and late evenings. They can provide you with information, perhaps with medication, or to see a pharmacist, or to perhaps see a social worker or a nurse. Every situation is different. So without knowing much about the individual other than reducing his anxiety, the 800 helpline number I would suggest to contact, because we have clinicians 24 hours a day that get all kinds of questions. And wherever you're located, if you're not in Maryland or, the national capital area, we're like 70 offices nationwide. So I'm not a clinician, so I would recommend the helpline. And I also would turn it over to Will for his suggestion.
I think you answered that beautifully. You could always call our local number and ask to talk to care management as well. We have clinicians on our staff as well that could maybe field a question or two. But yeah, and we also just put in our chat line that the number to call as well that Michelle just mentioned.
Okay, so again, if you have specific questions, we'd love to answer those questions and recommend our hotline, the clinicians to help you with those specific, whether it's medicine, Medicaid, anxiety, treatment, those types of questions, we definitely will recommend you to talk with our hotline. I would love to answer any questions that you might have regarding Alzheimer's as far as getting involved and answer any questions that you might have about the walk. One of the questions I know that we get quite a bit is whether you're able to bring your dog. And you are able to bring your dog as long as your dog is well behaved. And we actually have a pet corner that you can bring your dog and have water and snacks. So the event on the National Mall is, let me just share. This is our contact information if you need, if you have any specific questions about the walk, or if you have specific questions about getting involved, about being a speaker, you can contact Michelle. Um, but on the National Mall, if you are interested in registering today, I encourage you to use that QR code. Or if you're so feel inclined, if you'd like to make a donation to Will or someone on his team, you can certainly do so. Again, the walk is on September 27th. It's on a Saturday. Registration starts at 8 a.m. The event begins at 9:30 with a program, and then the walk begins at 10 o'clock. We have a 1 mile and we have a 2 mile route. We have several different tents that you can visit the day of the event with different sponsors that are going to be participating. Alexandria Toyota is there, Sibley Hospital is there. Visiting Angels will have a tent as well. Um, they are a national team. And Will, did you want to say something about that as well?
Yeah, I'd just like to open it up. We would love. We're still taking team members. We'd love anyone that's interested in joining. The information's here where you could reach out. We could use as many people to support this great event as possible.
Yeah, and you can, again, if you can wear something from Alzheimer's or wear something to signify the visiting angels, or if you have something from them, you could definitely wear something from visiting angels. But we just love to have you come out and be a part of it. Again, it's free for everybody. We will have food and refreshments, and we're located on the 14th Street in between Jefferson and Madison. So it's an opportunity for you to bring your family and friends, and we'll have great opportunity for pictures with the national monuments in the background. So take advantage of this opportunity. And then it's a great time to have brunch or just head home or spend the day in DC and go to a museum.
Anyway, yeah, we can move forward with our event today. Thank you.
Okay, great, great. Will, can you share a little bit about some of the things that you guys have done to raise so much money? I mean, you've talked a little bit about some of the proceed nights, but you've also done some other stuff and planned out some things. And how do you go about getting some of the partnerships that you work with in order to raise money?
Yeah, it all comes down to collaboration.
Mm-hmm.
Every week we have an Alzheimer's meeting, and one part of the meeting is, what's the event of the month, but the other is, yeah, who do we know, um, and putting our heads together. And so I think it's a combo of a couple things. So, um, one thing, like I think I mentioned, the T-shirt sponsorship was large, large event. So we went to just kind of our backyard for some of these, to raise some of these funds, and then what we did is, some of our team members are really creative, and whether they were realtors or um, lawyers, we really kind of cast a wide net, um, and by doing that, we were able to get we were successful with the T-shirt sponsorship. And then I think I mentioned before being creative. One thing we did that was different, and I mentioned the event tomorrow, but working with some of our referral partners and some of the facilities that we visit on a daily basis and getting their buy-in was really critical to help build these events with the community. So I think it's, yeah, being creative, casting a wide net, being organized, and also like everyone, uh, I guess I could speak with like our team is just very diverse and they have very strong networks, and so we were able to tap into that.
The things that I wanted to piggyback on what you're saying, Will, is we have a document, and I'm happy to send this to you,
Hmm.
anyone that's on the call. It's called a sphere of influence, and basically, what it lets you look at, and what Will's talking about as far as how do you collaborate and how do you come up with all these contacts. I mean, it's a sheet that really helps you to look at who are some of your personal vendors that you use, who are some of maybe your kids' communities that they're involved in, your church or spiritual home, your synagogue, ashram, whatever you, as far as your mosque, whatever your religion is, if you have one. Also looking at sports groups. Are you involved in any other extracurricular or hobby activities? It really has you take a look at maybe, also college friends, looking at what are all of your different connections. And so it really helps you to write all of that down. So if anyone is interested in that, I can put my email address on here. And if you are interested in getting one of those, it's called a sphere of influence. It really is helpful for your fundraising efforts. And also, if you are, as Will said, just also reaching out to getting other people involved in the team. So you can, as well, getting people to be a part of the walk the day of the event. So, Will, you're one of our top team leaders, so one of our top team captains, and I appreciate everything that you guys have done. Um, how many years do you know that Visiting Angels participated in the? I know this is your first year, right, participating, but
Yeah.
it's Visiting Angels has been a part of the Alzheimer's Association and been a part of the event for several years.
Yeah, we've been doing this for I want to say about 7 years, but yeah, fairly new. But what I can talk to you about what we've done currently, and every month since March we've had an event, and actually just this week alone we've had 3 events to help raise funds. This is something that our Visiting Angels group, we've been in the community for since 2002. This is something we take really seriously, and then Visiting Angels corporate as well is very involved. So um, this is something that's near and dear to our heart, and um, honestly, it's um, it's almost part of it's fundraising for Alzheimer's Association is something that we do almost every week. And the reason why we do that is just because of our client population. Just so many of our clients, this touches their lives, and that's why there's such a connection to what we do.
Michelle, in the DMV area, are you able to share with us some statistics on how the Alzheimer's is affected? I know it's affected in Virginia, Maryland, and DC differently, but in DC or Virginia, in Maryland, I know that in Maryland, there's quite a high population of people that have Alzheimer's that are affected. And a lot of it is due to Baltimore population. But can you share a little bit about some of the statistics on Alzheimer's in this area?
Yes, thank you so much, Heather. Nationwide, women predominantly are 2 times more likely to get Alzheimer's or related dementia. And the prevalence of Alzheimer's and related dementia is highest in the nation, in the state of Maryland, and in Washington, D.C. And so this is our territory. The National Capital Area focuses on Washington, D.C., Maryland, and Virginia, but Prince George's County, Maryland, and Baltimore City, Maryland contribute to our state of Maryland within the National Capital Area, and Washington, D.C., both having the highest prevalence of new Alzheimer's cases and dementia cases. And so that's just, unfortunately, for this area, I can't tell you, because I am new to the Alzheimer's Association as well, but I can't tell you what is behind the statistics, but we're here to try to, as Heather mentioned, put Heather and myself out of business and find a cure. That's our goal. We're trying to find a cure for this disease. And unfortunately, 7 million people nationwide now live with Alzheimer's disease and related dementia. It went up just from last year, it was 6 million. So in 1 year, it has grown.
Wow. One of the things that Michelle and myself that what we do is we go into the community and we provide different programs and education, and that is one of the things that obviously research, advocacy, and programs and the hotline. That's why we raise money, and so educating people about getting Alzheimer's materials and getting information about Alzheimer's, and also learning about the diagnosis, the warning signs. Um, there are 10 different warning signs. And Michelle, I don't know if you want to talk a little bit about some of the warning signs, but we have a presentation that we do within the community, which we offer up to large groups. And we also offer information about the difference between dementia and Alzheimer's, right? Alzheimer's is a form of dementia, and there are several different types of dementia, and that is what the Alzheimer's Association is looking for, a world without Alzheimer's and dementia. So we cover it all here. And I don't know if you want to share a little bit about some of the warning signs, Michelle, while we have a couple minutes here. And Dexter, I don't know if you look to see if we have any more questions.
We are clear, Heather. So, yes, Michelle, if you could share some of the goodie goodies inside your ALZ goodie bag there, that would be awesome.
Sure. Thank you, Dexter. Thank you, Heather. So just a few, I don't know how much time we have, but I'll try to get through all 10 briefly. The 10 warning signs of Alzheimer's disease and dementia, one being the first one, memory loss. Memory loss that disrupts daily life. We may forget, I forget all the time here and there something, but if it's prolonged and it affects your daily life over time, you need to check on that. That's one of them, memory loss that disrupts your daily life. Number two, challenges in planning or solving problems. There may be some times where you could do a puzzle, and then after time, you're just trying to, the simplest thing you cannot solve, or you're doing some planning. Perhaps you're the person in your family that plans all the holidays and you're known for that, but over time, you forget, or you're having challenges with that. That's another warning sign. If that's new or different for you, you should check that. with a physician. Number three, difficulty again completing familiar tasks, things that are just day-to-day things that you would do. Number four, confusion with time or place. You don't know where you are, you don't know where you live, you don't know how you got there. Confusion with time or place is another warning sign. Number five, trouble understanding visual images or spatial relationships. Who are you? Why are you here? Is this my home? I don't know who you are. Just trouble understanding things or visual images that you normally would know. That's a warning sign. Number six, new problems with words or speaking or writing. If you usually would say hello, good morning, or how are you doing? And somehow you can't do that any longer over a period of time, it's a warning sign. Number seven, misplacing things or losing the ability to retrace your steps. I don't know where are my keys. I forgot that. I forget my keys all the time. But if you do that prolonged, and you can't remember and trace your steps where you actually found or put them, then you should think of that as a warning sign. Perhaps it may not be, it could just be a bad day, but you still would like to follow up if it's prolonged. Number eight, decreased or poor judgment. Things that you would normally not do, like, for instance, get in a car, perhaps if you've been drinking, but over time you're not thinking of that, you're using poor judgment, and maybe that's not the best example, but over time using poor judgment where you normally would stop and not do something, but you do it anyway, and you don't know why you're doing it, that may be a warning sign as well. Number nine, withdrawal from work or social activities. You may have been, or you may be a social butterfly. You're always at parties, you're always there, you're the life, and everyone knows you for that, and all of a sudden you're withdrawn, you're quiet, you don't want to talk, you don't want to be socially around people, and your family is noticing that. That's a warning sign. That's not normal for you, and that's okay, but you still could check on that because that's not normally what you would be doing. And number 10, changes in your mood or your personality. Briefly, my mom passed away last year with dementia, and she had changes in her mood or personality. She didn't know who I was, and I'm her daughter. She was aggressive. There was a time where she would push family members away, and you may see that. That's a warning sign. That's not your normal family member or friend or person that you may know of. If you see that there's a mood or personality change, question that. That's a warning sign. And so that's all I had at the moment, Heather.
Thank you. Thank you so much, Michelle. I don't know if you have anything else that you wanted to add on that, Will, but I think that and how visiting angels has helped people with care, as far as seeing some of these changes in some of the folks that they are working with, and what are some of the things that visiting angels can help with.
Yeah, actually, I think that yeah, Michelle covered most of that. Yeah, one thing is that we do have, I think, there's different forms of Alzheimer of dementia, but we have the care specialists when you talk to whether it's our case manager or one of our clinicians that know the nuances of Alzheimer's and how best to match you with the care that's going to make your loved one most comfortable.
Thank you.
Mm-hmm.
Well, again, I just wanted to, this has all been a wonderful session today, and I appreciate and thank you so much for letting me be a part of it. Dexter, do we have any other questions?
We are clear as far as question goes. And yes, I would just like to add on what Will mentioned there. So one of the things, challenging things, of course, for a caregiver to be doing is doing caregiving without a break or non-stop caregiving. That is why I would just like to remind that visiting angels also offer respite program and respite care. And if I believe Will has more information about how this could start as a free subsidized service from visiting angels, right? And I think, taking care of someone with Alzheimer's and respite care would really be a good match. Yes, Will, if you could help me out here, my friend.
Yes, thanks, Dexter. Yeah, so we work for the Montgomery ARC, and they have a respite program that we're affiliated with. Then that's what Dexter was talking about. Then, one thing at Visiting Angels, we view ourselves, it's the care that we provide to our clients, but we also try to be a resource. There's also the Medicare guide program that's it's been around for only about a year, but we have the software in our back end, and if you or a loved one has um, any form of dementia, whether it's early or late, you might be eligible up to 70 hours of care. And if that's something that's of interest, our Visiting Angels, um, based off just really name, date of birth, and the Medicare beneficiary number, we could find relatively quickly if you or your loved one might be eligible for that guide program as well.
Yes, that's beautiful. Thank you for reminding us about the guide program as well. So, just all right, here's how we're gonna help you after this coffee chat. So, Will, if I'll be working with Will, since we're recording this coffee chat, you're gonna get the URL of the uploaded, edited version of this so you could just watch the replay easy. And then, of course, in that email, let me know, Will, if we could add the information about the guide program as well in that email. And whatever resources and attachment that Heather and Michelle could give us, that would also be great.
Michelle, thank
So,
you for being a part of today. And want to encourage everyone to come down to the mall on September 27th, the National Mall. Be a part of 2,500 people celebrating life, recognizing and being a support for each other, and come down to the mall. If you aren't able to do a 1 mile or 2 mile, feel free to still come down. You can there are volunteer opportunities. There are opportunities to just be a part of the day, and again, put a plug out for Visiting Angels as far as, being part of their
that
team.
our coffee chat happens every third Wednesday of the month, and we will be again sending you an invitation to join us for our next month's topic. And are we leaving that as a blind item for now, Will, or are we announcing the topic for next month? What do you say?
Uh, yeah, next month's topic, it's called the Armed Forces Retirement Home. It's in the D.C. area. It's actually in Washington, D.C. It's a little hidden gem that many enlisted soldiers don't know about, and we're gonna kind of just talk about the resources that they can provide.
All right. Beautiful. So, if you know somebody who might be able to get some value out of that, stay tuned. We're going to be sharing the registration link very, very soon. Anyway, have a great day, anyway, everybody. Thank you very much, and we'll see you again on the next third Wednesday of the month. Bye bye.
At Visiting Angels, we're committed to enriching the lives of elders and their significant others. Our monthly coffee chat sessions aim to make your lives easier and better by providing quality information from our expert panelists. We're here to elevate your quality of life, offer practical wisdom, and ensure you have access to valuable insights. See you again next third Wednesday of the month.